Now let's look at common musculoskeletal conditions and common examination methods used with these conditions. The first category of musculoskeletal injuries we will examine are overuse injuries. The mechanism of injury for these types of injuries is repetitive motion or overuse. The first example of an overuse injury is bursitis. A bursa is a fluid-filled sac in the body that is located between structures to reduce friction. The example in this slide depicts the subacromial bursa, which is located between the acromion process of the scapula and the humerus, and you can see it right here. This is the fluid-filled sac. In this case, repetitive shoulder motion can increase friction in this area and cause inflammation. The following video will show you the subacromial bursa and how it can be impinged with shoulder motion to cause subacromial bursitis. As this pans in, it will show you the subacromial bursa and expand it so you can get a good visualization. Now you will see the shoulder motions that cause this impingement. The second example of an overuse injury is tendinopathy. Tendons are connective tissue that connect bone to muscle. Tendinopathy literally means disease or disorder of a tendon. There are two categories of tendinopathy, tendinitis and tendinosis. Tendinitis means inflammation of a tendon, and tendinosis means a condition of a tendon. So what is the difference? Well, tendinitis is inflammation of a tendon, so the inflammatory response is active. Symptoms include heat, pain, redness, and swelling. Tendinosis refers to a tendon that is worn out over time and is weak and painful. This is a chronic injury of failed healing in tendons and results in degenerative changes from overuse. Examples in the slide include patellar tendinitis or jumper's knee, which is depicted here, which occurs with repetitive running and or jumping activities. Another example is tennis elbow, which is depicted here. This results from excessive gripping activities. The third example of an overuse injury is nerve entrapment. A nerve entrapment occurs when there is pressure on a nerve. The most common example is carpal tunnel syndrome. This is compression of the median nerve in the carpal tunnel. On the slide, you will see the median nerve as it passes under the carpal ligament, as depicted here, and as depicted here. Excessive and repeated wrist flexion activities cause this disorder. Symptoms include tingling, pain, and weakness in the wrist, thumb, and radial digits as depicted on the slide. So here we have the pain distribution, and here we have the numbness distribution. Now let's examine traumatic injuries, another category of common musculoskeletal injuries. First, a ligament sprain. A ligament is connective tissue that connects bone to bone and supports your joints. The mechanism of injury for a ligament sprain is a traumatic incident that overstretches or tears the ligament. This causes pain and instability at the joint. A common example depicted in your slide here is an ACL ligament injury or anterior cruciate ligament injury, and this is a result of a traumatic injury to the knee. This slide also depicts a medial collateral ligament injury right here, which also can occur from the same traumatic injury. Another traumatic injury is a fracture or a broken bone. A common wrist fracture is depicted in the slide. You can see it right here. This fracture is common in the elderly. Elderly are more susceptible to fractures, secondary to changes in bone composition that occur with age. And finally, another traumatic injury is muscle strain. A muscle strain can damage the muscle and or tendon and occurs due to a sudden contraction or overstretching of a muscle or tendon. The example in your slide is a gastrocnemius muscle strain, and in this case there is damage to the Achilles tendon which connects the gastroc muscle to the heel bone or calcaneus. You can see this depicted right here where there's a complete rupture of the tendon. Other common examples include low back muscle strain and whiplash. In some cases, a tendon may rupture completely, as in the case previously discussed, and these injuries require surgical repair. Other common musculoskeletal disorders include the trauma resulting from surgical procedures and from other medical conditions. In regard to surgical conditions, therapy is needed to reduce pain and regain motion and strength and prevent complications such as dislocations, contractures, and muscle imbalances. Examples of surgical conditions include rehabilitation following ACL reconstructive surgery or repair of torn ligaments. Another, as seen on your slide, would be a total joint replacement, depicted here. Total joint replacement involves replacement of joint surfaces, usually of weight-bearing joints, such as the hip or the knee. They are needed when degenerative joint disease is so severe that a person cannot function fully due to pain. Another example of a surgical condition is amputation. Amputation can be necessary due to trauma, inadequate blood flow, or malignant growth. This is depicted on the bottom of your slide. After surgery, physical therapy is necessary to regain function and includes the use of prosthetics, or an artificial limb, and ambulation and functional training. Complications following any of these surgical procedures can include contractures and poor healing, so the PTA must be ever diligent to watch for these and prevent them as possible. In addition, systemic diseases may cause weaknesses or loss of function, and physical therapy is useful for regaining strength and function. Examples include rheumatoid arthritis, cancer, and AIDS. In the case of rheumatoid arthritis, this systemic autoimmune disease causes inflammation characterized by enlarged, often inflamed joints. You see in your slide the joint deformities that can occur with rheumatoid arthritis, and you see these here. Physical therapy can be useful for patients to learn how to protect their joints and how to regain strength and function.